Okay, so we're gonna be discussing today management that relates to asthma management when you are sick, when you are dealing with a flare up. We're also going to discuss when you have inhalers and you feel like the side effects are preventing you from taking the inhalers because of the side effects. What do you do? What I would recommend. My name is Dr. Mkono. I honestly think that it's very important that we first and foremost involve our doctors in whatever we do because they know you best. I am just here educating for those people who are able to really maneuver their care. They have to involve you have to involve your doctors because they know you better and they probably will be able to advise everything, keeping your medical history in perspective. I am very sure that they know you better than me because they see you, and they know you better. They just know you better. I just don't think that I can ever claim that I know you more than your doctors know you. So again, my name is Dr. Mkono. I'm on live today, and I'm on live on both YouTube and TikTok. And that is, I'm trying very hard today to get on. I had promised myself that I will get on. I was on earlier today on TikTok. And just a few of you were on there, but for those people who are going to be following today, I just want to make sure that I'm available to answer some of the questions that may arise as you go over the information that I show on both platforms, basically. I like to talk about asthma and COPD mainly because they're such easy things for me to go over. But it's hard when you have these illnesses and you do not know that simple thing as holding your breath for 10 seconds helps you cover your medication throughout your lungs. And it is more um, likely that you don't think that's an important part because we're saying hold for 10 seconds. The reason we say that is so that the medication actually delivers into the lungs. Otherwise, it's going to be either you would breathe it out, you exhale it out, or it doesn't get delivered in the lung where it's supposed to be working. The breath needs to be held for a good 10 seconds. If you do 5, that's fine. But if you do less than that, then you could get a breath that is not sufficient, and then you have your doctors increasing doses on the same inhaler, but it makes no difference because you're not getting the whole thing. So I am just going to just go over different things about inhalers. One of the biggest things is just understanding that your schedule is very important, but that's after you get the technique. Because if you don't get the technique, then you miss out on delivering the medication to your lungs. And even if you're doing the same thing 100 times a day, which you shouldn't, it will still be wrong because you didn't get the medication down to where you need it, which is your lungs. Okay. So if you guys have questions, please make sure you chime in and write me the questions because at this point I do not hear you guys. I see you going in and out. I can see whoever comes on here. I can see you guys swiping in and out. I just can't speak to you guys and hear your voice. So if the only way is if you actually write a question, then I can read it. I will try to talk and tell you guys what I think you should know about your asthma and COPD management and give you as many tips as possible. But if you ask a question and you stick around, then I'm able to take a look and answer that question if you happen to have a question that I can address. So we're gonna go over some of the things that we should talk about is if you get coupons, yeah, your doctor gives you one of these and says go and use it, maybe hopefully to make it cheaper on your price. They give a few of them. Somebody had mentioned, I can't remember if it's on TikTok or YouTube. Oh, why don't you just give them a coupon? These coupons are not always accessible, but if your doctor gives you one, then that's nice. Just make sure you use it before it expires, and then, at least you have a way to afford the medication. But for the most part, most of you are challenged with affording the medication, and then it's becomes an issue because you didn't know that really if you have insurance you really have to follow the plan according to what your insurance covers. If they cover an inhaler and the inhaler is on your plan and your doctor prescribes it, then it's a match. You're going to get it whatever price they've elected it to be at the cheapest possible price on your plan. However, if we don't pick the one that is the preferred, then you get a very big bill and you don't want to pick up your inhaler and you probably could get sick and you still have to pay a big bill when you get sick. So it's really important you understand that even if it's expensive, to work with your providers to get you the most cheapest possible combination that works for you. Don't fall in love with too many of these inhalers. I have a lot of these inhalers, and I have to tell you, they're grouped in different categories, okay? And if one, you can't afford one, it's not completely interchangeable, but like through this line, we can change things around to kind of match what your provider prefers. And the only way to figure that out is actually you getting that list. Don't expect your providers to start knowing and memorizing what your preferred insurance wants to prescribe. We won't know that. We just send out, okay, this is a class of medication that you need. These are the two medications you need. And then we hope that you are covered. And so if you go to your pharmacy and it's expensive, then what you need to do is literally go back to your provider and say, look, it's expensive. But sometimes you don't get to see the provider again. So the smart thing to do that I advise my patients is that instead of saying, well, you know, it was expensive, it's more expensive if you got sick and you didn't take your inhaler. I have to tell you that it's way more expensive because you're going to go to the ER um, and see that that's more expensive, or see a bunch of doctors multiple times, and that doesn't make sense. So it's expensive either way. It's expensive to fill the inhaler, and it's expensive to see the doctors, and it's expensive to go to the emergency room. So it's so important that you figure out what's cheaper. To me, what's cheaper is getting the inhaler that is approved on your insurance, and the way to do that is get your plan. Your plan has a booklet that it says, hey, these are the cheapest contractual medications that we're going to give you. And it's not just inhalers. All your medications go on this booklet. And each plan has its own list. And if you want to go online with your doctor, that's great. But we are so busy, we're not going to go online with you. You should really print out that list. My advice only, you don't have to believe me. Print the pages, you know, usually like someone here printed this for me and brought it to me and said, hey, you know, this is what my insurance prefers. Why don't you pick something out of there? That would be a better option. Then the doctor can see, okay, fine, you're supposed to be on this inhaler. I'm going to give you this inhaler. And then this way it's less circular movements back and forth, trying to figure out what's covered and what's not. It's a painful spot for me, the coverage, because for the doctors, we are not trying to be the insurance agent, but we are forced into being one. And everybody is quick to call the doctor, not the insurance. So it's like the necessary, I don't know, it's like I do my part and then I have to do the insurance part and the case management part, and everything else kind of falls on to the doctor. And everybody has to just understand that you have different parts in your insurance. Your insurance has a place where it says, this is what's covered on my plan. So you need to go through that with your either your insurance, or get smart and actually include a list of your prescriptions when you see your doctors. And what's even more important is you carry over to your doctor your current medication so they can see you use them and make sure that you're actually, you know, compliant and your technique is perfect. Because if it's not perfect, then you could just pay for it's just lost money because you're not going to get it in your lungs and then it's not going to work for you. Okay. So today I'm just going to go over briefly. If you guys have questions, you can post them and then I can go over that. But if you don't have questions, I totally understand. I'm going to go over a few things now that we knocked down the insurance people. You can stick around and learn something, or you can ask me questions and then I can try my best to answer those questions, of course. Yeah, and we're going to go over some inhalers. together. Yeah. So if you have questions, you can ask me. I'm going to look and see if anybody wrote questions. My brother has asthma. Oh, okay. Someone on, I believe that's YouTube, says their brother has asthma, and I hope your brother knows how to use their inhaler and that they know there's a difference between a rescue inhaler and an inhaler that we use for maintenance. If they don't, you need to tell them they need to know the difference. The rescue inhaler is the one that we use for breakthrough symptoms. And the maintenance inhaler, if you're prescribed, is the one that we do not negotiate. It is on no matter what, whether we are sick, well, or rain or shine. Those are the maintenance inhalers. They need to be on a specific fixed schedule because if they're not, they don't work very well. And we need to know how to use them. So hopefully, your brother, you can tell him those two things. And then, maybe you could help him out. But I'm glad you mentioned something and thank you for communicating to me on, I think they're communicating to me on YouTube. I'm getting them all confused. But anyways, so we're going to go over this. And before we do, I want to discuss asthma separate from COPD, but I want to tell you that they're very similar in how they affect you and the treatment is very similar. So we're just going to group them together for the sake of trying to be simple. Just remember that COPD, most people have it from actually cooking with charcoal and the rest of the world, but being in different parts of the world, some people just think of cigarettes. Of course, cigarettes are not helping, and they cause a lot of COPD as well. Okay, so this is a mannequin that I use quite a bit, and I try to teach people about asthma. When it's early, you can reverse things. See this? This is a healthy, small airway, deep, deep, deep down in your lungs. This is asthma, congesting with phlegm and secretions. This airway is open and this airway is congested, if you can see on both sides. This is a healthy airway and this is a congested airway. This is an asthmatic airway. And it's tight. When you have congestion, you feel like you're breathing through a straw, which is because all your airways, and you have lots of airways, but they will have like congestion. And the congestion then makes it very difficult for you to breathe, and you feel like you're kind of overwhelmed with secretions. The secretion itself is dangerous in two ways. It plugs you and it mechanically blocks you from breathing. And then you have the squeezing of your lungs. And when they squeeze down, then you can't breathe. Sometimes you wheeze, sometimes you just feel short of breath, you feel tight, you can't catch your breath, you wake up at night, you're wheezing, you're tight, you don't feel like you're getting a full breath, you feel like you're trapping air. Some people feel like they breathe in and then they exhale and they feel like they can't do both. Sometimes, especially the exhalation, you're trapping air. And this is why it's so important when you take inhalers. I ask you guys to always inhale first before you take a deep breath. Nebulizer is a different story because you're going to get multiple breath. But with an inhaler, you're getting one breath that you're holding down. And therefore, you really need to make sure that you hold that breath long enough so that it is capturing your medication. So, nebulizer, we put a mask on and we just breathe for like 10-15 minutes. And breath from an inhaler, we're doing one big, we got to fill the tank with all that medication and we need to hold that breath for 10 seconds. And if you can, count to 10. I don't need you to pass out, but do count longer than 5 seconds so that the medication is being delivered into your lungs. Okay? So we are again, my name is Dr. Mkono. I'm waiting for questions if you have them. If you don't, it's okay. But I'm going to go over some generic information for people who have not met me before but are interested in knowing how things work and why they need to take the inhalers. So I'm about to go over that right now. Okay. So there we are. Those two airways. And then if we don't catch you here or treat you here, we get worse. This airway is very thick compared to this. See? This airway is plugged and thicker than this one and this one. And then if you don't control it all the way, it gets really bad. it gets thick and it just restricts permanently. That's years and years later. You get it like that. And then it's like tormenting because you're here and we should have really corrected things right over here. And we didn't get that chance because you probably said you take your inhalers and you don't, and you eventually got to here. This is like scarred lung that is restricted permanently. Now it's no longer trying to expand when we give it inhaler. It just stays stiff, stuck, and you can't breathe, and you constantly circling all the pulmonologists and ERs and in the hospital and staying, and you're blaming everybody at that point because you probably have lots of infections, lots of resistant bugs. You don't know how you got there, but you get there by one day at a time, not doing the right thing. So you can get there in multiple ways, but people like to talk to me over here. I'm trying to talk to you over here where you can make a change and protect yourself. Okay? So thank you so much for their hearts. You want to get over here with me so that we can stop you from being over here where you're labeled by your hospital name rather than your home name. And that is because this is a better lung to deal with. And I like to talk to you about here because this is where we can deposit the medication and it works. When we start dealing with this, I mean, you cannot reverse a scar. The scar is a permanent thing. I'm trying to deal with you before you present yourself as a scarred lung. And I can only deal with you at that moment when you are listening to me and I'm telling you, take your inhalers. Don't try to think you can control your breathing because you can't if you truly have asthma. If you don't have asthma, it's a whole different story. If you don't have COPD, it's a whole different story. But if you have these diseases and they progress and even more dangerous, we keep giving you strong medications after strong medications over time. As you look like this. And this is difficult because now you're really ready to listen, but we can't reverse you to this, as you can see. I like this. This is where I want to talk to you. And that's why I exist. But over here, we still help you. We just tell you, please mask up, don't get sick, use your inhalers, all that good stuff. But you end up on oxygen over here more often. You end up in the ER more often. It's irreversible. And then you say, I'm using my inhalers. I don't see any change. Why? Because this side is permanently damaged and this one is reversible. You spasm, you look like this, you clog up, and then we bring you back to this and you say, I'm gonna go natural, I don't need anything, you're fine. And then the next thing you know, you're over here. And then you come to us, we reverse you over here. You see that? We just keep reversing you. But over time, we go between these two with steroids and antibiotic, and you like your antibiotic and you say, as a matter of fact, I don't want you to use this medication. What works for me is this one. You try to tell the doctor what to do. And of course, the doctors usually comply, right? Because we don't want to be delayed. So we comply with you. And we give you the antibiotics after antibiotics, after steroids, after steroids. Meanwhile, I'm talking to you about you need to be able to understand the system. This is your system over here. And this gets on when you're well, not when you're sick. When you're sick, these are kind of beyond the situation. This is taking care of mild illness, and when you're sick, you're in superior illness, and that needs superior treatment. It's pretty much the same thing, but we give it to you by pill form or IV form. And I'm talking to you because I want to let you know that something as mild as this only works if you personally get on it early and use it consistently. So after you say, oh yeah, I know how to use my inhaler, that's great. But if you don't apply it as it's been scheduled, you're the same as the person who didn't know how to use their rescue or their maintenance inhaler. You're the same because you have it, yet you use it the wrong way. So these work, they do work, but you need to know how to use them, and then you need to know whether you should be applying it once a day or twice a day. You cannot make a twice a day medication a once a day medication. It's very important. Why? Because that's how they made them. I didn't make them that way. I'm just letting you know. And the reason is because these are both steroids and they're pure steroids. This is Alvesco. I don't need you to memorize any names. And this is our annuity. Both of these are steroid only. They don't have an albuterol inside. They will work similar. But this one is a once a day and this one is a twice a day. So you cannot swap this. I hope you know that. Just because we gave you this and you're like, well, let me be cheap and then maybe I can make it last double the time and use this sparingly. This is a maintenance inhaler dosed twice a day. This is a maintenance inhaler dosed once a day. So when I give you that equation and I talk to you guys over and over again and say, take an inhaler, make sure you perfect your inhaler technique, make sure you perfect your schedule, and then be consistent. Put it next to your toothbrush, apply it twice a day. If it's twice a day, apply it once a day. If it's once a day, very different than the rescue. Rescue is just to take care of what doesn't work out with these. You can add on the rescue. And if you keep adding it on, there's a problem with you or there's a situation building up and you need to sort that out because that rescue should just happen once in a blue moon. It should not be a consistent thing. So, like I said, we can make these and we call them different things. They come in different canisters. To me, these are equivalent, but they're not the same as how we prescribe them. I will give you this twice a day. I will give you this once a day. And I expect you to do it and reapply every single day, once a day, before you say this is not working. If you use one puff, it's kind of like applying lotion today and expecting it to work for the rest of the year. It's not going to work. You apply it, this will last 24 hours. After 24 hours, it will go down to zero. And this one will last 12 hours. After 12 hours, it will go down to zero. So, how do we do it? The twice a day for once a day is going to be, the once a day is going to be one puff today is 10, 20, 30, 40, 50. On the 10th day, you're going to be at 100% effect. And then you can continue it on going forward at once a day. And that's a good patient if you know how to use it. And the ones who are on the twice a day, you would apply it twice a day, every single day, in the morning and at night. If your doctor said twice a day, 2 puffs, you would do 2 puffs in the morning, 2 puffs at night. And by the way, please do not do something like this. Don't do that. Don't do that. You need to do it 1 puff, wait a few seconds, maybe let's count 30 seconds to a minute, something more than just puff puff, and then inhale because you're really not utilizing it properly. These things are expensive and you want them to work for you. You give one application, you hold your breath for 10 seconds, then you wait like 30 seconds in between and you give another puff. If you're using a spacer, you would extract it a few times out of the spacer and then you would do your next puff. So just remember, 2 puffs, we are not saying sequentially do them like one on top of the other. Try to do them separately, okay? So again, my name is Dr. Mkono. We're just having a really small discussion. It's really past due. I have been saying I will sit down with you guys. I will talk to you guys. I have not been able to do that. But today I made it as my thing to do for the day that I will go over medications and we went over, for those people who missed it, we went over why medication is expensive and what can we do about it, because if we are using a medication and then the medication is expensive, we want to make sure that everybody can afford their medications. If you live in a place where you can just buy it and it's cheap, it's still very expensive for many people to buy their medications. So therefore, you use the medications to work for you by applying them the right way and making sure that they're put to good use, right? We went through like, for those who are missing and they want to rewind, we went through different booklets that are created by each insurance to, oh my God, to make my life difficult, basically, and everybody else's life difficult. They make contracts on what is cheaper. Some people, the insurance will pay for this one. So you have to learn how to use this one. Even if I wanted you to prescribe you this, you'll pay too much money. So we teach you how to use the one that your insurance covers. They're equivalent, but they're not the same as far as how you apply them. We can find out from this booklet that your insurance covers is cheaper. We move you from this to this, but we say use this once a day. If we find out that this is cheaper, we move you from this to this. But we say this one is twice a day. And we may say 2 puffs twice a day or 1 puff twice a day. and each one has its own dose and strength. So it's very important. I hope like I'm not like, confusing you guys. Yes, I could be potentially confusing you guys, but I hope that I'm making it easier and you understanding that you should go and read your script and find out what works best for you. Okay. So we're gonna go over a few inhalers. Somebody asked me why do I have 2 inhalers in one of my videos. It depends on which inhaler you have, what you've been prescribed. You know, I have a lot of inhalers. I teach them, so we can talk about these for a long time. We can talk about them for a short time. For those people who are going through, look at how many different kinds of inhalers there is. It's really to make you confused, right? I prescribe them on a daily, so I know. But can your doctor confuse things? Yes, they can, because sometimes they switch too fast and you all of a sudden have gotten your rescue inhaler and you're using it as your maintenance inhaler. That's a common problem. I don't want to overwhelm you guys, but there is way too many inhalers. I just want you guys to know that they're all very different. One can have albuterol only, one can have albuterol and steroid, another one can have albuterol and ipratropium. They can just have different things inside. So these, though, they tend to be twice a day. These kind tend to be once a day. This one tends to be twice a day. You need to figure out which one yours is, because you definitely cannot come to me and say, oh, I'm not doing better, and you're using a twice a day medication when you remember. That's your rescue. Very different. It's so different. If you're going to use inhalers, at least know where they're going to work. I know some of you don't intend to use inhalers, are not on an inhaler plan. But if you're on these and you're going to say, my inhaler doesn't work, number one, make sure that your inhaler is actually being applied to you and your lungs, not you and your mouth. Lungs, it's going all the way down to the lungs. So you want to and suck in that air with medication so that the lungs get the medication, not spray your mouth. Your mouth is not the problem. The issue is down here. So make sure you know how to use your inhalers. They will not work if you don't know how to use them. Once you get past that, you graduate from the first phase. I then grab you and say, let's talk about that schedule and that dose. The schedule is twice a day and you're using something once a day. It's nice that you got the technique, but you are failing on the schedule. It's fixed, it's applied again and again when it's maintenance. And if you want your maintenance to work for you the proper way, you skipping around the maintenance is completely confusing your lungs and they're never going to reach their therapeutic level, and your doctors will keep escalating things and they shouldn't really be doing that, right? Because they're escalating because you're not doing better. And then they say, well, let's talk about injections, right? See, I have them and I talk about them and I say, guys, before I take my patients into injections, I usually make sure that I treat them like I would treat myself, in letting you know the injections are applicable only if these particular things that we're talking about do not work or do not cover you enough. So you can imagine your doctor switch you in this and you were using this once a year or once every week. This is a twice a day medication. It did not work out because maybe you didn't use it twice a day. And I'm not saying you should go back to your doctor and stop this. I'm just saying talk to your doctors about what you're doing, because they're basing their management based on what you say and how they test you and how you come out. If you come out with flaring lungs, angry lungs, they're going to say, well, we need to upgrade you into injection mode. Okay. They put this and they say, we're going to give you this once a month or whatever your schedule is. You're going to be doing that. I'm just over here. I'm still over here because I think they do work if you know how to work them, if you know how to prescribe them, if you know how to use them, if you're using them in the right schedule. And so that's why it's so important that I spend some time with you guys, because no video in the world is going to summarize everything I have to teach you. I need you guys to digest this stage by stage. If you are on inhalers, it's so important that you get to know me and maybe what I have been, you know, producing, because I want you guys to know that every single day, including today, I meet a person who has asthma for 20, 50 years, whatever. They don't know how to use the inhaler and it's a problem. If I don't get them on the technique, I get them on the schedule. And if I don't get them on the schedule, I get them on the inconsistent use of their maintenance. So it's a few steps. And I'm worried about all three of them because I have an equation that I want you guys to remember. The equation says inhaler technique is first. Please memorize that because that technique is the biggest one that everybody does a boo boo on. And then the next thing is inhaler schedule. And then after that, consistency. Put it next to your toothbrush. Go to it once a day if it's a once a day medication. Go to it twice a day if it's a twice a day medication. Rinse your mouth, gargle, spit out. Why do I say that? Some of these things get stuck in our throat because it's trying to transmit the powder or the mist down in your lungs. In that case, please make sure that you gargle with water and rinse off after use. Okay? For those people who are taking inhalers, they expand their lungs good and they still feel like things are getting stuck, especially the powder ones, they can get stuck. You can ask your doctor to switch you to one of these that is equivalent. The ones that you see here, you shake them, and then this doesn't have a powder consistency. It is kind of, misty, right? The powder ones, they look like this. Let me see if this one has. Yeah, this one is out. But when you tip them over, they have like a powder on them. Um, I don't like that one. But the powdered ones, not everybody can tolerate the powdered ones. And I think sometimes we have to switch things around regardless if you like it or it's not, if it's giving you side effects. Instead of you stopping completely, ending up in the hospital, we want you to make sure that you speak to your doctors about what is your problem. If it's powdered and it's getting stuck, you rinse your mouth. If that doesn't help, sometimes we have to treat you for fungal infection that happens because the powder gets stuck in the throat. But that's all not to scare you. You're supposed to use your inhaler, and some of these inhalers, you've got to rinse your mouth. So if you don't remember, get yourself a sticker, write it on the sticker, or write it with a pen. Rinse your mouth after. There's a few here. This one, rinse your mouth after. This one over here. There's a few. And some you don't need to rinse because they have albuterol. But for the most part, if you don't remember the difference, then rinse your mouth after all. So that's pretty much most of it. And I'm now going to go over some inhalers. I'm just going to go over a few and then I'm going to run off and I'm going to read if there's anybody with questions. COPD is treatment with the same for COPD. Thank you. Yes. So many people, I group COPD and asthma together. Thank you so much for the hearts. I group them together because they're very similar. We use inhalers, they cross over, but when you're asthmatic, we like to give you an inhaled steroid in your plan. When you're COPD, we don't have to. We add it as a last thing. Otherwise, sometimes we also have, thank you, um, eh, um, we give you a combination and we include three inhalers in one sometimes, like the trilogy. The trilogy looks like this. Um, and then we have another one that's called Breeze Tree, right? It's got three in one. That one can be when we don't know if you're asthma only or asthma and COPD, we put all three in one sometimes, or we think different parts are contributing to your illness. But for the most part, I group asthma and COPD as the same, but they are not the same. They affect the lungs the same way, shortness of breath, wheezing. From a patient perspective, we can group them. From a medical perspective, we should not. A lot of the things that happen to asthmatic will happen to a COPD because both of them are kind of destabilizing the lung. Both of them kind of make your lung work off sync from you. They're like you're breathing in, they're breathing out, and vice versa. It's like not coordinated. Your breathing is working against you rather than with you for both of them. But from the COPD perspective, it's because of that smoking and the fumes and the dust and things that are going in your lungs affecting you. From an asthma perspective, you can have pollen and fumes and environmental things that can happen, weather. It's just sensitive lungs. Either way, they make the lungs start secreting phlegm. The phlegm itself is just basically like you applying peanut butter onto your lungs. That phlegm is like delicious to the bugs, and you get pneumonia, 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 bronchitis, bronchitis over and over again because you just keep plugging and making this delicious gunky stuff from whatever route you have. That right here. hmm This one. And then you can breathe because you're breathing through this pinhole for both of them. And you can wheeze. And the other one, we call it ronchi, but it's the same thing. You start making funny noises in your lungs behave and start breathing like they're clogged, basically. And they are clogged. When they really, really get clogged, when we get a pneumonia, it's because a complete lung section is completely wiped out with phlegm stuck in it. And then the lung is not breathing properly. And it just gets really inflamed and sick, and then we call it pneumonia. And some people panic. Why bronchitis turned into pneumonia? Well, because maybe you delayed the care from the beginning. Or why am I getting more pneumonia than others? Because you have all the nice stuff. You have all that phlegm that attracts the bugs, and the bugs love it, and they infect you and they stay there. So if you want to deal with it, you have to deal with trying to dry up those lungs, and these will dry the lungs up. Not in the way you think of it, but it is drying it in the sense it's not making you create phlegm over time. And do I need to take the inhalers forever? Yeah, most likely for now, yes, until they find a cure. If you don't want to be in the hospital, if you're sick and tired of seeing doctors over and over again for the same diagnosis, bronchitis, 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 you need to get tested for asthma. Maybe you have asthma. You need to be on maintenance inhalers. And then pneumonia, 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 and then MRSA, MRSA, God knows everything else, because your lungs just they have a magnet for the bacteria. And the bacteria are just innocent. They're opportunists. They wanna, you know how people opportunity, like they find an opportunity to do something and they do it. Kind of like me right now. I'm taking this opportunity to teach you guys because it's an opportunity that I find it's easy for me to do. But the bugs are finding it easy to live in your lungs, basically. You're providing the moisture, you're providing the darkness, the gooey, gunky stuff that you're not treating, and they're there innocently. So every time we get a cold, everybody get exposed, you get sick, and it never stops. It just goes on and on and on, and you tip over into my office, and we give you some steroids and antibiotic. We need to talk about your asthma. You could say, I grew out of it, but if it keeps happening, guess what? You either pay those fees multiple times or find out whether you're doing everything right. And my suggestion to you is that find out from the very beginning, is the technique right? I know it's like taking you back to the beginning of when you got diagnosed, but majority of you literally go like, let me see if this one has anything. I don't know if this one does. Shake it up. Okay, this is it. Those blank ones. Let me see. Demonstration. Shake, shake, shake. Yep, that's primed. Shake, 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 shake. Nothing came out. But when you shake, 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 and then, yeah, that comes out. I don't know if you guys saw me because I have two screens going. I'm talking over here and there, like, yeah, trying to do both of you guys, TikTok and YouTube at the same time. That is not good. I have a problem with that because then you're going to say it doesn't work. Of course, it doesn't work. You just release all the medication. How is that going to work? And then you need to apply it. You using anything on your skin? Like I do stuff on my skin. I do not use it once a year, right? They will say, do this at night and do this during the day. We do it, right? Same thing for the inhalers. There's no difference. And then they're going to say, well, you know what? We can inject this. No, I don't do that part. I don't inject my skin. But for those people who inject, that's a whole different thing. Maybe you feel like they do this in the morning and do this at night doesn't work. We inject. We do the same thing in asthma. That's when we inject like steroids in you and strap you next to a bed, and we keep you there, and we check on you every few hours, and you're now stuck and interrupted. I'm talking about, we're going to do the same thing, but we're now going to inject it because we need it to work immediately. These things work, but they need like a 10-day lead to be good in protecting your lungs and working for you. If you use them sparingly and, drop it here, drop it there, it may not work. And then you're going to be telling me, well, I'm on Brio. Yeah, you are, but you were on it last year. You're not on it if you own it, but you don't apply it properly on the schedule that it's supposed to be. So for those people who asked me a question, I'm going to review and then I'm going to run off. So I hope you guys had a chance to go over some of these inhalers. If you have a request, I'm happy to do an inhaler for you. I am going to go over like some basic inhalers here before we go. But I'm preparing you guys because I want to make sure that for those who stuck around, maybe they can identify one of the inhalers here. We're going to go over it quickly. Oh, I found a nice one. Look at this one. Yeah, and these. See, so many different styles. You're gonna be like, which one is the best? The best is the one that you can afford. It's cheaper on your plan and you can afford it. That's the best for me. And then it covers what you have. If you have COPD, we have certain ingredients, severity, asthma, whatever. Okay, so let's talk about this. So I'm going to also add the spacer business to it. I did regular technique. I'm going to do a spacer. Anyone who cannot get these inhalers in them should get a spacer. Why? Because then you're not getting your medication and you're going to miss out on the technique. And it doesn't matter if you're consistent because you didn't get the technique. It doesn't matter if you are following the schedule. So I have her said it over and over again. Technique plus schedule. Twice a day if it's twice a day, once a day if it's once a day, plus consistency equals control. And we can start talking from there. It does not cover you from getting colds because if people have colds, they should stay away from you. Your lungs are going to react really crazy when you get a cold. Why? Because they're not going to like it. Way worse than everybody else. So you're not in the same team with everybody. So don't compare notes. Yeah. Okay. So protect yourself. I do. And I don't even have asthma, but I know when I get a cold, I don't like it. So I wear my mask because everybody coming towards me is coughing and hacking, and I don't want to get any of that. I also don't want to give you anything. So when you're around, I go, and then when you leave, I'm over here. And for those who are paying these huge bills in the ER, you may have to consider the same thing. Cut down the exposure of the bugs that are going in and having fun at your expense, right? So shake it up. You can put it in here. It fits. People think there's one size. No, it fits. But first, I would prime it, shake it, put it in like that. See? You take it out so you can see as well. Shake, put it in here. This side is a one-way valve, meaning you're going to extract, you cannot blow in. If you blow in, I usually blow in anyways, you feel the air coming back at you. But the whole point of this is to trap this so that even if your technique is terrible, you still get a chance to dispense the medication from the can. So it's just extending your time and reducing your palpitations about your technique. And you can get time to relearn it. It's not a permanent thing. But I say for people who are demented, people who have a lag in learning, the young, the frail, I put a spacer because I don't think I'm patient enough to teach them. I mean, I'm sure you can do anything. You can teach anybody anything. I believe that. But the time in the clinic is so little that I would just give you this if I find that you do not know what you're doing. Because the whole point of this is not an ego thing. It's just we need to get you to take your medication. So you then look, press it, put your lip here. 3 times, and then you pump again. You do it every breath. You try to circulate that air and get like 3, 4 breaths out of it. Why? Because you now are different from this technique, the other one that I was teaching you earlier, which is coordinating that press and the together simultaneously. In, if you do this, you want to make sure you're exactly the same. If you can't do all that, it's too much for you. We put you here and we make it simple. We make sure that you get your medication. So this is a technique. Do you need to rinse your mouth after? Yes, especially for those who do not know what's in here and do not want to learn it. Go ahead and just rinse your mouth after all of them, but it's really not after all of them. It's certain kinds. Okay, so that we've done that one. Any of these could be a rescue that goes in here, meaning it's an emergency device, or a permanent device like a maintenance, non-negotiable invite, right? There is an invite here. I'm sorry, I don't do those things. But rescue, this is not a rescue, this is a maintenance. I need to find a rescue, but you guys should know it's like albuterol sulfate. This is a rescue, but this rescue doesn't get on a device. It can just open. Look at this. See this? It's already triggered. Okay? You open it, it's triggered. You exhale, and then so these are very easy. So if you have a medication that goes in here, there's 2 kind of, I've seen Air Duo. I think Air Duo goes in here, but this is a Pro Air Respy Click, and these are very easy to use for those people who don't need coordination, no shaking, no nothing. But you do need to remember to close it, because every time you open it, that's the trigger. Check and make sure you have enough. Exhale. Close. I'm counting fast, but you would count slower. And if it's a duo, you would rinse your mouth. If it's this, you don't need to. This is a rescue. Easy one for the frail, the people who can't coordinate. We really want to make sure the insurance covers this for them. But guess what? They usually don't, because this is a newer device. It's more expensive. Just get on one of those rescues that look like this. This is not it. I need to find my rescue. I don't know what happened to it. I have a rescue somewhere. Well, it looks just like this, but it's called albuterol sulfate instead of um, what I have. So there's just so many of these, and I'm not going to teach you all of them, but I do want you guys to know there are so many devices, right? And we don't want to go crazy. The most difficult device, here it is. I found this very challenging to use. For those people who are joining in late, you're not late. You can definitely do a rewind and learn all the goodies from me. I'm really doing a little marathon here today, and I'm just trying to utilize the space and time to reorient everybody about what we do here. We learn the inhalers, we make sure that you guys know why. You don't just collect them and claim you're using them, you actually use them properly. And we're going over what makes a good patient and what makes a bad patient. A bad patient is one who owns one of these and uses them on the wrong schedule, and they don't stay consistent on their maintenance, and then wonder why they're back and forth over and over again to see the pulmonologist, the urgent care, the ER, the allergist, the ENT, and God knows what else, because they're not better. They're not better because of many reasons. And then they're going to say, well, I need an upgrade. You need an upgrade, but usually after you've figured out if you've done the bare minimum. This is the foundation. It is critical that everybody understands that. If you don't understand it, it makes it very difficult to get better. Okay? And this here is the most difficult, I think, personally, inhaler to use, because it's confusing. Maybe I was stupid when I was learning it, but it took me some time. So this one, for the Brits, they call it Tebuhaler. For people who live elsewhere, maybe you would call it Asmanex. Asmanex, and then there is similar. Asmanex has a pink thing, but it's similar technique. And Pulmicort, Flexhaler. There's a lot of names, but this one is a very popular one. I like this one for the people who are pregnant. If they still distribute it, I would say some places don't keep the same inhalers forever. They kind of take them off the shelf. But this is the one I would use for people who are pregnant and the ladies who plan to be pregnant. I put them because this one has budesonide in it. And I like to use the budesonide because the budesonide inhalers are safer. Don't go crazy because we do use other inhalers for pregnant women. Yes, we do, because none of them are really considered bad, but this is the safest level. So if your insurance pays for this and it's good, get this one, even though it's a lower, it's harder to teach, but you can learn. And or you can have your insurance people change it to something else. Your doctors will work on that. Okay. So this one is a twist and then twist back. So I will go like this. Twist like this and then twist like that. You hear that click? Twist like this and then twist like that. This part gets twisted. Twist like that and then twist like that. See here? Twist like this and then twist like that. So, what do we do with that? When you're doing these, you need to know how to twist. And if you do not know how to twist, you won't get your medication. So you take it and then you're not going to get anything. This is a demonstration device. It will whistle. Yours will not. Mine whistles because it's a demonstration device. What we do with these are twice a day for those who are prescribing like me. Maybe your doctor is different. I don't know. But this is a twice a day medication. Do it twice a day for it to work the best. If you do it sparingly, like a rescue, it will not. Okay? I'm not a provider for you. I'm just trying to tell you. Follow the directions. Here we are. Here, you're going to take this and you're going to go one way, it won't do it. You need to go the other way. One way, and then you're going to bring it back. Two, you hear a click. It's good to go. Exhale. That's all it takes. And it's done. So if it's two puffs, what do? We take it again. We go like this. One, and we go one, twice, right? I've said clockwise, counterclockwise. It's confusing even to me when I watch those videos. I think the best thing is to hold the top part. See this? There's a little part up here that doesn't twist. It twists down here. The brown or the pink, for those who have different devices, you hold it like this and you twist one way and then you bring it back. Listen to this. Click. It's ready. Exhale. You count 12 to 10. I said 12. You don't need to go to 100. Please don't. It's not a marathon. It's just enough medication to go down. Now, this one is Air Supra. It's very similar to this one. I already taught you guys this one. This is a rescue that they've upgraded and added some steroid inside. So because usually rescue don't have a steroid, this is an upgraded one, right? You got to rinse after this one. I know it's small amount, but I would say rinse after it. It's pretty, but if you are good with your maintenance, you technically should not need this. Your regular rescue should work. But let's say you got on this. Do me a favor and don't go and drop your other ones. They look the same, but the dosing is different. These are exactly the same ingredients with different dosing. This is like 5 times bigger than this, but they look the same. And this is for rescue purposes and this is for maintenance purposes. You really need to follow what you're supposed to be doing with your particular prescription. This too, you would check your device, see whether it fills, see here, and then you would open it, shake it up, prime it, nothing comes out, shake it again. Yeah, This is a teaching one, so it's not going to have anything, but you should see like a mist come out. When you shake it, you should see something like that, right? Then you exhale. And that's it. You're done. Like this means you took your inhaler. If it's a rescue, then you leave it. If you need to do 2 puffs, you will do 2 puffs. If you need to connect it into a device, you could connect it into a device. If you do not know how to do that, I just went over that. You can rewind and check what I did. I'm not going to show it with everyone. I'm trying to show different techniques on different devices. This one, it is a generic of this one. This used to be Advair. So I'm going to teach you both of these right now and then go on to the next one. This one here, you would open it. You check where you are. See, I just did this. You open it. Then you click. When you click like this, the number should go down. So that's what it is. You would close it. And until the next time, it's now re-triggered. This has gone back on top for the next day. Or if it's 1 puff twice a day, this is how we do it. You'll be doing it in the evening, morning and evening, right? And because it is a maintenance device, you will not skip. You will do morning, evening. So morning is 10%, 20, then 30, then 40, then 50, then 60, then 70, then 80, then 90, 100. By the time you go to the 5th day or the 10th application, you've maximized your use, you're now at full dose. They come at different strength. If that dose doesn't work, your doctor needs to go up. If it's too much, they need to find the lower dose that works. That's between you and your doctor and your testing and evaluation and your symptoms and how you've been admitted or not admitted. Pneumonia, not pneumonia, feeling tight, not feeling tight, shortness of breath, not feeling short of breath, running, not running. All those things make a patient into compliant, non-compliant, controlled versus non-controlled. It's very important to understand that each one of these has a different strength. This one is dosed at 500. This one is dosed at 250. They're very similar. They can be compared. Both of these are twice a day. This one is a once a day. You can't use the once a day as a twice a day and vice versa. I keep saying that because people do that and expect something that's supposed to be used twice a day to work as a once a day. No. This is made to work for once a day, but you got to use it every single day. So it is technique plus schedule. So this is a once a day. Technique plus schedule. This is twice a day. Plus consistency every single day equals control, and then good judgment on when you say to your doctor, I'm on an inhaler and it does not work for me. Now they can go up and down and you're on the same page. If you do it any other way, you're seeing your doctors and you're wasting your money, or they're adding things that they shouldn't do, like these injections, because you and them are not on the same wavelength. You're on your different plan and they are just prescribing and they don't have time to teach you. They don't and they will not. Going forward, things are just going to be like that. No one is going to have more time. You're going to be looking for this video. I project, which is why I'm here. Because personally, I teach my patients, and the sad part is they're not like, oh, yeah, thank you for teaching. They're upset how long they wait. How can I possibly teach you all these things in like a 20-minute or 30-minute visit? It's impossible. I can't do it. So I have to do it here. And my patients are sent here all the time because I want to make their experience with me shorter in this sense setup of teaching, and I can refer them to this library. So even if only one of you guys is going to watch and come back, my patients, I plan to send you these videos for sure, 100%. You're going to get a video from me, especially when we have to do this hocus pocus, switch around. Your insurance said no to this, and now they've got you on this. Oh, doctor, how do we use it? Well, you could Google it, you could chat GPT it, you could do whatever, and then I'm going to add my little time with you also personally telling you, please take the inhaler, rinse your mouth, keep the schedule, be consistent, follow up, get checked, all those good things. Otherwise, you're on inhalers, but the inhalers are owning you in financially and doing nothing for you if you do not know this information. So we're here now. Yes, we're going to be here. This one is Vixella. This one says 55, I think. Does it say 55? Oh, no, it says 35. Sorry, can't read. And you're going to open it. See? I love this one. So cute. They're the same. This one is the same as this one. It's also the same as this kind called Brio. Same. This is a once a day. This is a twice a day. One puff twice a day is how I prescribe it. If I need to go up and down, I reduce the dose on the canister, not the frequency of use. We know the difference. We write it that way for a reason. We do not say we're going to go down, so you go down for once. Why? Because if you do once a day on a twice a day, you do once, you get your 10%. In the evening, you get 0. The next morning, you wake up with a 0, right? At night, you're waking up with a rescue. It doesn't work like that. 10 in the morning, you renew it 20. You renew it 30, 40, 50, 60, 70, 80, 90, 100. 100, 100, 100 for infinity. However, if you do your own schedule on a maintenance inhaler, you're putting 10 and then you're inviting admissions, hospitalizations, because you're missing the rest of it. Maintaining, protecting your lungs from infection, because if infections hit your lungs will be extremely equipped to unleash that fire. And I'm pretty sure you know the fire. It goes into the hospital and in your bank. With admissions, hospitalization, doctor visits, and consultants added onto the panel. You saw pulmonary, it's not enough. You need to see allergists, you need to see ENT, you need to, because all the doctors are spreading you out to try to make sure they don't miss anything, right? So that's what it is. So, anyways, we are almost going through all the inhalers. I'm almost done. I will be showing this one, which is the Spiriva. I don't think, well, I mean, I can show this one too. This right here. And then I think you could cut and paste. And I don't need to show you Dulera because you've seen it on the other one. And this is actually this is albuterol sulfate. I forgot. This is similar to this one, but they're not the same. The devices are different. This is a rescue device, and this is a maintenance. No choice. Every single day you're using it. No option. And this one, optional. Breakthrough. No, excuse me. This one is maintenance every single day. No negotiation. And this one is, oh my God, optional. Add it to your regimen. If you're on an optional schedule, like your optional turns into a schedule twice a day, 3 times a day, something's wrong. Either you have a flare or you are not supposed to only be on an optional. You need to be on a maintenance, and optional needs to be added. So it's a clue. Something is coming on. The weather is changing. A flare is coming. A pneumonia is coming. A bronchitis is coming. And you keep waking up pumping that rescue. It's a problem. Go early before things get really bad. You can also do hospitalization. You can do nebulizers at home and then go to hospitalization if needed. See your doctors. They can give you nebulizers. They can give you steroids, antibiotic if you need them. They can check a chest x-ray, making sure that you do not have a problem with a pneumonia. So, and I'm going to, I've used, oh, okay. Okay, good that you're doing that. I keep getting trash after using. I wonder what that means. I'm gonna look. I like the comment. I just don't know what that means. You may have to write that again. Ah, good. Thank you. I'm on TikTok and I'm reading what people are saying and just making sure that I didn't miss a comment. If I did, please rewrite it and then I can go over it again. All right, so this one, we open it up. It was like this. You open it, 35. You go like this. Bring it down. It's triggered. You let it go. You exhale. And then that's it. This one, you kind of taste it a little bit. Most of you guys have inhalers you taste. The reason we rinse is that, but we really rinse because the powder can actually get stuck in your throat. Right. Okay. So make sure you gargle with water. You take water, no need of Listerine, water, and spit out. Put it next to your toothbrush. I think that's the best place. Um, I'm going to go over this one. And we're almost done. I'm almost leaving. Yeah. So this one, see this one, how it says 250? This also has a 500. By the way, when this one gets closed, that's when the trigger goes back up. See? This is 500. This is 250. You see how you can't compare? Oh, I'm on the purple this. The dosing are so different. You shouldn't be comparing with people unless you know the dosing and their schedule. Don't compare notes. Your lungs are your lungs. Everybody's different. This one, you see? You would open it. Yeah, and then I'm going to tell you guys a trick. If you notice the names, fluticasone, salmeterol, I have it up. You can't really read it. Fluticasone, salmeterol, those two medications. The fluticasone has a sone, S-O-N-E, means there's a steroid. Rinse your mouth after that one. And the salmeterol is like an albuterol. You can get palpitations from that. So if you're getting palpitations from that, you feel your heart racing, you can talk to your doctors. Your doctors can adjust you to something that doesn't have a steroid in it, like this one. Because, I mean, something that doesn't have albuterol in it, like this one. It really means you need to talk to your doctors, okay? Don't just play your own doctor. So this one, we open it. This is the generic Advair. Has a little thing here. You bring it down. Then it's going to change the number. That means that cartridge is exposed. In fact, if you do this, if it has medication, you will see the powder there, okay? So you don't do that. You hold it, exhale, just like I said every time. Why do we exhale? I exhale because you want your lungs to be empty so it can receive a full breath of the medicated breath. And then you hold it down so that the dust kind of settles and gets you to work. Treat it just like if you're doing lotion. You put a drop here and you do this and you let it marinate inside your skin. The lung has a skin component. That layer where the dust settles is skin. We are producing therapy to the skin in the lungs. You need to make sure that you stay consistent. It's so mild that you need to be consistent for it to work as a maintenance. Don't confuse it with albuterol. I definitely don't want you guys to be using albuterol puff after puff. You really need to go see someone because you're missing a maintenance. If it's once in a while and it's not waking you up at night, maybe you're okay. But if it wakes you up at night, it's a deal breaker for me. We need to talk. You need to come in. We need to talk about why you're waking up at night. Could be reflux, could be the carpet, could be the air. It doesn't matter. Your asthma is telling you you need to wake up. It's not good. So just want to let you know that's a red flag here. See? You brought it down, right? We clicked it. Exhale to empty all the lung and receive the full breath with medication. That's it. I think I got everything except this one. And then I'm gone. I'm actually almost out of batteries. See? This one. So this one has Spiriva, Stravati, oh my God, Stialto. 3 of them. They all don't have actually steroid that I can recall. They have albuterol with ipratropium, like, or tiotropium. They are like this. There is one more that I will try to squeeze in. Only I can't remember where I put the can. That's the Spiriva. Oh boy. So this one here. Well, maybe next time I'll be more organized, right? Spiriva has a little container there. Oh, there it is. I got it right here. Got it. Anyways, so let's do this quickly and then go from there. So this one, Spiriva, Stravati. Oh my God, I tell you, we collected too many. Look at this. Same. I'm going to teach you. These require you to load. You get them like this. They come in 3 components. Very easy. You stick this in here. You push it all the way to the end. It's got a cursor right over here. It's got a cap. This cap has a little dent there. You fit it right here, like a gap. Now, the trick to this, so you don't waste this expensive medication, is keep it closed. Twist the bottom and the top separate one way, right? It will not go the other way, trust me. You open it. This is your trigger. If you twist it like this, it will trigger as you're twisting. So you keep the cap closed for that reason. You open it up. You exhale. And then you press and inhale at the same time, but I'm going to show you what it looks like when I press. See? Yeah? I'm going to do it for you guys. And then, see? So now I'm going to do this for you guys. Twist one way. Why I do it this way? Because if it just kind of like doesn't twist completely, you can trigger it without having your mouth there. I don't know. Some people do it like this. Some people do it like this. I like this. Exhale like this, down or up. As long as you can twist and press, you're going to press here now. Empty. Same concept. If you don't take that whole breath, actually this you may actually see air escape, but make sure you take your whole breath and time your breath properly, that you click and extract your medication so the medication can be delivered to your lung. Close it. This can be dosed 2 puffs. Like this one, it's 2 puffs once a day. You're going to do 2 puffs once a day, but this one is more times, like twice a day or 3 times a day, because usually people use it as a rescue. But if it's your maintenance, then they'll probably tell you to keep it on the schedule every 6 hours. This one is once a day in the morning. You're going to do 2 puffs. So talk to your doctors. And that means this one is consistent. Every single morning you'll be doing it. Put it next to your toothbrush. This one may be given as an as needed to add for breakthrough, or it may be used as your maintenance. Make sure you talk to your doctors about how it's prescribed and use it that way. Because otherwise, if you use it anyhow you like, you may be saving a few dimes only to spend $1 billion on your admission. Check out your prescriptions and follow. We know the difference in writing use it when you feel like it versus use it scheduled. If it said schedule and it gives you refills, maybe you should be on it. Otherwise, it will cost you an admission, hospitalization, and all that. So this one is the same. Now I'm going to talk to you about this one. This one is Spiriva. Guess what? This is how people get confused so quickly. This Spiriva and this Spiriva are the same. They're both called tiotropium. However, this one is 2 puffs once a day. This one is 1 capsule once a day. So yeah, okay. You can't get it confused. So the capsule goes in here. There's a little seat there. We drop it in. And see? It has a little thing here. You close it. This is crushing the pill because it's a pill. Crush. You can crush it 10 times. Doesn't matter. Crush it, crush it, crush it. 1 time is good enough. All you're doing is breaking it so that the powder can be released from the capsule. You exhale everything out. That's it. This is the Spiriva. But if somebody swaps you and you're using this once a day and all of a sudden they introduce this, you do not, if unless your doctor said so, you don't just do one puff. It's 2 puffs for the dose. And this one is 1 puff for the dose. If you didn't get enough, you can do multiple doses on this, but you can't do multiple doses on this because each capsule releases 1 dose. And this one, each twist releases 1 dose. Very different. So I hope you guys have benefited. I'm going to check if you have questions, and if you don't, I totally understand. You guys probably know it all. You don't need me. I'm just going to try to see if there's any further questions, and then I'm going to leave you guys. I never hold my breath that long. Whoa, if you don't hold your breath, how is it going to work? You have to hold your breath. It's an inhaler. I hope we met for that reason today. Um, I can't see if it's a lady or a man. White diamond. Yes, thank God we met today. Yeah, and then not only that, you do not just hold your breath. Make sure you exhale so you can hold that full breath of medication. Count to 10. You don't want to pass out. If you just get to 10, maybe over time, you guys will get 5, and then you go to 6, and then you go to 7, then you go to 8, holding that breath. And if you need support, get a spacer. Go back and rewind what I've said. I know I'm going very fast. I just wanted to make sure I got through making sure that every inhaler that I needed you guys to understand that they're to prevent all these needles that are happening. Everybody has faith in the needles. I personally take care of patients and I think they do just fine taking inhalers, except for the very few. Because realize asthma and COPD has grades. Some people have mild, some people have like mild disease. And then you have the people who are severe that belong in my clinic. I see the mild coming to me, and most of them come to me because they don't know how to take care of this part. I'm supposed to see the severe because they have failed all this. But guess what? This still gets piled on. And they do this. Yeah. So you need to know what you're doing. And your doctors need to spend some time with you, and they will not be doing that because we do not have the time anymore. They're making it very difficult to the teaching. The teaching is, please check it out. It's weird that there is so much information and then the patients are coming without any. I do not understand why. I just want to let you know, look it up, understand it, ask questions, advocate for yourself. It makes no sense. Everybody pretty much walks around with a computer. Check it out, see whether it works out for you, write 2 or 3 questions for your doctor, and go out there and find out what's happening with you. Is it you do not know that you're supposed to apply your inhaler technique perfect? Schedule, yes. Once a day is once a day. And if we wrote twice a day, we know the difference. We wrote twice a day for a reason. So twice a day is twice a day. Don't make it twice a day and once a day, and don't make it once a day, twice a day. Vice versa. Lastly, consistency. The biggest key. If it's not applied every day and it was supposed to be applied every day, 365, and you're using it only when you feel sick. Once you're sick, you're on a whole different level. These inhalers will not help you. They are preventative and prophylactic and helpful then, but not when you're sick. When you're sick, we may need to do much more. So don't, many people writing questions, oh, but when I started, it doesn't help me. I'm coughing a lot. I respond to them, guess what? Go see your doctor. Take care of that acute problem because you may be up in the sky and we need to bring you back to earth and then apply this. I wish you all the best and I hope you learned something from today. And I hate that you guys are 5 people watching today. I'm very grateful because I talk to myself for the most part, and I believe you will come back to it when it's 0, when you really urgently need it. So I'm counting like 100 because I think 100 of you guys will come back, the ones who didn't show up today. And for those people who showed up today, hopefully this was it. Not only entertaining, it was actually informative. And if it was, when I post this live, wherever it is, YouTube, you should show up at YouTube and tell me, or even any of my videos and say thank you for all that was done today because I'm so proud of myself for showing up. I hope you learned and you picked up a few tips. And if you didn't, slow it down. Look at the library of videos I have, look at the lives that I've done, and the questions that people ask and the answers that I spew out on a regular basis. And the comments, the funny ones, and there are no funny things, but I'm trying to make it more entertaining and less dry, because it is asthma. It's boring for most people, and COPD, unless you're sick and you're seeing one of us and we're giving you a bill, correct? Anyways, see you guys. Have a good day. Take care. I'm going to say goodbye if I know how to say goodbye.